Okay, so now we're moving into the vestibular part of the exam. So their head is going to start to move. This first test is called the head thrust test or the head impulse test. Okay, and so what you're going to be looking for is the patient's ability to maintain gaze while their head is moving. And so you're going to ask the patient, is it okay if I help you move your head? So Tina, I'm going to have my hands on the side of your head. Is that okay? All right, great. So I'm going to have you just stay nice and relaxed and keep looking at my nose with your eyes. So what we're doing, the first thing I did is I oriented her head down 20 to 30 degrees to get those horizontal canals in the plane of motion. And I am going to have her stay nice and relaxed, keep looking at my nose. I'm going to do a quick head thrust each direction. And notice my hand contact. I had the thenar eminence of my thumb on the temples of her head, and then my hands wrapped around. So I had a nice firm hand contact. Okay. If we're lower on their jaw, that's a lot of play. Cheeks are a lot of play, so that's really the best place to get at a good grip. So things that are important for this too is notice I had a very small but quick movement. So you want this movement to be quick, but you don't have to crank their head. You're only moving their head about 20 degrees. And then a normal test, a negative test, is that when I thrust their head, her eyes stay right on my nose. They don't budge at all. A positive test for this is that her eyes come off of my nose and they snap back. It's a very quick motion, but you're going to see a refixation saccade. And the direction that you're thrusting their head towards is the ear that you're testing. So for an example, when I thrust Tina's head to the left, I'm testing the left VOR. When I thrust it to the right, I'm testing her right ear function. Okay.
And if somebody has glasses on, you can take the glasses off, because when you have your hands around their head, sometimes the glasses get in the way. It's not an acuity test. They just have to stay focused on your nose. So the fact that your nose is blurry is perfectly fine.
Yep, definitely.